Nearly 60% of adults over 45 carry dangerous levels of deep belly fat, and most of them have no idea, because this is not the fat you can pinch. This is the fat buried deep inside your abdomen, wrapped around your liver, your heart, your kidneys. You cannot see it, you cannot feel it, but it is doing damage every single day. And now, a peptide called Tesamorelin is getting a lot of attention as a way to reduce it. But before you consider it, there are things you need to understand. Because this is not a simple fat burner, it is not cheap, and it is definitely not for everyone. What deep belly fat actually does. Here is why deep belly fat is different from regular body fat. The fat under your skin, that is mostly storage. It sits there. But deep belly fat is active. It behaves almost like a separate organ. It messes with your insulin. It pushes fat into your liver where it does not belong. Over time, this drives up your cholesterol, raises your blood sugar, and increases your risk of heart disease. A study published in the Journal of the American Heart Association found that people with high levels of deep belly fat had a 44% higher risk of cardiovascular events, even when their weight looked normal on a scale. That is the part that catches people off guard. You can look fine on the outside and still carry dangerous fat on the inside. What Tesamorelin actually is. So where does Tesamorelin fit in? Tesamorelin is a synthetic version of a hormone your brain already makes. When you inject it, it signals your pituitary gland to release more of your own growth hormone. That growth hormone then raises something called IGF-1. And IGF-1 is what helps your body break down fat, repair muscle, support recovery, and maintain collagen. Think of it like this. Tesamorelin does not replace your growth hormone. It nudges your brain to make more of it, the way it used to when you were younger. After about age 30, your body's natural growth hormone output starts to decline, roughly 1 to 2% per year. By the time you are 50 or 60, that signal is significantly weaker. And that decline is one of the reasons belly fat becomes harder to lose as you age, even when your diet has not changed. The big misunderstanding. Here is where most people get it wrong. They hear about Tesamorelin and assume it somehow hunts deep belly fat specifically, like it knows exactly where to go. That is not what happens. Tesamorelin works through the same growth hormone and IGF-1 pathway as other peptides. The difference is not in the mechanism. The difference is in the evidence. Tesamorelin is the only peptide in this category that has been studied in clinical trials where deep belly fat was measured directly using CT scans, not just a bathroom scale. That is a big deal, because most fat loss claims in this space are based on body weight or waist measurements. Tesamorelin's data actually shows what is happening inside, so the real story is this. Same general pathway, but much stronger evidence for deep belly fat specifically, and a much higher price tag. What the research shows. Tesamorelin is FDA approved, but only for one specific condition, HIV-related lipodystrophy, which causes abnormal fat buildup around the organs. In clinical trials over 26 weeks, patients on Tesamorelin saw meaningful reductions in deep belly fat. Lean muscle mass was preserved. Some improvements in liver fat and cholesterol were also reported. But here is the part people skip over. When patients stopped taking Tesamorelin, the fat came back, unless they had changed their diet, exercise, and sleep habits during that time. The peptide helped open a window, but it did not keep the window open on its own. Timeline: when people may notice results. If someone does start Tesamorelin under medical supervision, results do not happen overnight. In the first few weeks, some people notice better sleep and faster recovery after exercise. Around weeks 4 to 6, recovery improvements become more noticeable. Between weeks 8 and 12, body composition changes may start to appear. Less fullness in the midsection, clothes fitting differently. The strongest belly fat reductions in the studies showed up between weeks 12 and 26. This is not a 2-week belly fat hack. This is a slow, steady process. And it only works if the basics are already in place. Side effects and red flags. Like any peptide that affects your hormones, Tesamorelin carries real risks. Common side effects include redness or itching at the injection site, water retention, joint stiffness, and tingling in the hands or feet. Some people report sleep disruption, which is worth monitoring, but the bigger concerns are metabolic. Tesamorelin can affect blood sugar. If you already have insulin sensitivity issues or uncontrolled diabetes, this could make things worse. And because it raises growth hormone and IGF-1, both of which can promote cell growth, anyone with a history of cancer or an active malignancy should not be using it. This is not something to order online and figure out on your own. It requires a physician, lab monitoring, and honest conversations about your health history. Tesamorelin versus other peptides. You will hear tesamorelin compared to other peptides. Here is how they stack up. CJC1295 combined with ipamorelin is often used for general growth hormone support, better sleep, recovery, and gradual body composition changes. It is usually much cheaper than tesamorelin and more widely available. Sermorelin is an older option. It works on a similar pathway, but has less clinical data behind it. Direct growth hormone injections are stronger, but they bypass your body's natural regulation, which means more risk of side effects and hormonal suppression. Tesamorelin sits in a specific spot. It has the best clinical evidence for deep belly fat, but it also carries prescription-level seriousness and cost. For most people exploring peptides, CJC1295 with ipamorelin may be a more practical starting point with a doctor's guidance.